We looked at 6 months before CAR T and looked at the patient characteristics, and we looked at the 6 months after. And what we found was, first of all, in terms of the patient characteristics, these were Medicare-aged patients. Half of the patients were over 71. Compare that to the average age of patients in the pivotal clinical trials, 55, 56, 58 kind of range. Also, we found that these patients, not surprisingly in a Medicare population, had multiple comorbidities, other conditions over and above their lymphoma for which they were being treated. In many cases, over 50% of the patients, in fact, had severe chronic conditions: chronic heart failure, chronic pulmonary disease, chronic kidney disease, the kinds of conditions that would have excluded at least some of the patients from the clinical trials. Nevertheless, we found older patients and patients with multiple comorbidities being treated with CAR T. Now, what else did we find? We found, by comparing healthcare utilization and costs in the 6 months prior to getting CAR T with the 6 months after CAR T, we found significantly lower utilization of hospitals, fewer hospitalizations, significantly fewer days spent in the hospital at a population level on a PPPM basis, if you will. The incidence of emergency department visits was cut down by a third, and the overall number of visits on a per patient per month basis cut almost in half. Overall healthcare costs, all-cause healthcare costs, 6 months before versus 6 months after, exclusive of the cost of the CAR T episode itself, overall costs decreased by, I believe, 37%. So what we found was that older patients, average age of 70, older patients and patients with multiple comorbidities can be successfully treated with this new innovative treatment.